Hi all, my name is Danielle Dennis, and today I'm going to be presenting on physical activity practices in the long-term and residential care communities and the COVID-19 impact. So first off, I'm going to talk about the importance of physical activity for not only adults, but older adults living in residential care communities. First off, physical activity is very beneficial because it reduces the risk of morbidity and mortality for leading causes of death in the United States. Data shows that individuals at any age and any level of fitness can benefit from physical activity. Participating in physical activity has actually been shown to help treat multiple diseases. This can be like cardiovascular disease, obesity, high cholesterol, osteoarthritis, COPD, high blood pressure, and diabetes. For older adults, physical activity is especially important as it reduces the risk of falls and injuries from the result of falls by staggering 35 to 45%. This is a huge reduction in risk that is very beneficial. Lastly, for older adults, participating in physical activity, specifically flexibility exercises, can help increase range of motion and make performing daily activities easier. Now that you have an understanding of why physical activity guidelines are so important, I'm going to kind of discuss what those guidelines even are and specifically what they are for older adults. So like I mentioned before, any sort of physical activity can be very beneficial. However, if an individual does meet the physical activity guidelines, they can see an even greater health benefits for themselves. The U.S. Department of Health and Human Services created guidelines in 2018. These guidelines stated that they recommended that adults should get around 150 minutes of moderate intensity exercise or 75 minutes of vigorous exercise, or a combination of both, and that's per week. They also recommend that 2 days a week of total body strength training should be done, and balance and flexibility should be incorporated into their routine. So that can be like chair yoga, walking, resistant band exercises, etc. However, despite having these guidelines out there, according to the Federal Interagency Forum on Aging-Related Statistics, only around 14% of individuals 65 and older actually meet the physical activity guidelines. And as they age, this number actually decreases, which is not a very good number. Now I'm going to talk about where many adults live, and this is the long-term and residential care communities. This is the place that we are studying. Long-term care and residential care communities are common living arrangements for older adults. In 2016, there were around 15,600 long-term and 28,900 residential care communities in the United States. That is a lot of places for people to live. Before the COVID-19 pandemic, physical activity and the promotion of the importance of physical activity was very overlooked. So the people there were not getting the adequate amount of physical activity that they needed. Now, after the COVID-19 pandemic, that has presented some challenges on long-term and residential care communities. It has created staffing shortages as well as funding issues. So this has also been a challenge for residents trying to get the adequate amount of physical activity that they need. So now that you know the background of this study and what we're looking at, I'm going to discuss the purpose of this study. So the purpose of this research is to evaluate local residential care facilities regarding physical activity offerings and needs of residents. In addition, the role of the COVID-19 pandemic played on activity levels of patients will be assessed. So like I mentioned in this slide before, COVID has kind of taken a toll on the long-term residential care communities. So we want to kind of see what that role has been and that impact. The specific aims of this study is to describe facility staffing, resources, and resident needs, examine physical activity practices at the local long-term residential care communities, and examine the impact of COVID-19 on long-term residential care communities and physical activity practices. So right now, we are still currently awaiting on our IRB approval, so we do not have any results that I can discuss, but I am going to kind of explain what we're going to do during this study. So first, we're going to look at long-term in residential care communities across Sangamon County, Illinois. They're going to be chosen and contacted via email. Through their email, we are going to send an electronic Qualtrics survey. This is a survey that we created kind of based off a bunch of different survey questions that have been out there, and then we created some new questions. There are a total of 27 questions on there with 3 specific areas of focus. These areas will examine information regarding the facility, staffing, and resources within the long-term residential care community. It will also help us see the impact of physical activity practices within the long-term care facility, as well as the current and desired physical activity practices that the residents want. And lastly, this survey is going to allow us to see the impact that COVID-19 has played on them, as well as how the pandemic changed physical activity practices regarding the offerings and staffing. So our conclusions, this is going to be kind of what we hypothesize since we don't have any survey results yet. We believe that our residents, the residents that are in these local facilities are not going to get the recommended amount of physical activity that is needed. And we also think that COVID-19 will have a negative impact on the physical activity practices in the long-term residential care communities. And these are our references. So thank you for listening. And then if you have any questions, feel free to join the breakout room. Thank you.